Hello, my name is Sherry Cornell, and the topic I chose was psoriasis. The reason why I chose psoriasis is because dermatologists and doctors are actually diagnosing psoriasis a lot more nowadays. Psoriasis is actually caused by the immune system. Patients that have psoriasis have a very active immune system, which means that instead of their immune system only fighting infections and bacteria, is also fighting skin cells. That means that the skin cells are reproducing a lot quicker than they should. By the skin cells reproducing so quick means that it doesn't have nowhere to go. It usually takes about a few weeks for our bodies to process the skin cells. Patients with psoriasis, it only takes a couple of days. They reproduce so quickly that our body doesn't know what to do with them, so it makes them grow a layer of flaky skin above their surface of the skin, and it also becomes in red and white patches. There are several types of psoriasis also. They categorize them differently depending where you get them in your body, how they look, and things like that. So each psoriasis actually has a name. I'm going to mention a couple of the main ones or the most common ones. Plaque psoriasis is actually the most common part or the most psoriasis that there is. About 80% of patients that have psoriasis have plaque psoriasis. And plaque can appear anywhere in the body. It could be in your hands, in your knees, in your elbows, in your legs, stomach, back, anywhere in the body, hair, well, scalp. And plaque psoriasis is actually red and white patches, and they also have that flaky, itchy, and irritation look above the surface of the skin. And it could cover from anywhere from 1 to 90% of your body. Less than 3% cover is considered mild psoriasis. 3 to 10% is considered moderate psoriasis. And anything above 10% is considered severe psoriasis. Goutte psoriasis is usually triggered by a bacterial infection, or it mostly appears in the upper part of the body. It could appear anywhere in the body, but it mostly appears on the upper part of the body. And goutte psoriasis is actually a small patches around the upper part of the body, and they're also white and flaky. Inverse psoriasis is more common, and it's actually more common on extreme overweight people, and this appears on skin folds or under the breast, also under the armpits. And these type of psoriasis, they don't have that scaly, flaky residue that the other psoriasis have, because this one is actually in moist areas. It's created in moist areas, so it doesn't create that flaky skin. Psoriasis can also cause joint pains, and about 30% of patients that have psoriasis have developed joint pains later on in their lives. And joint pains, you could tell because they start getting swollen fingers or toes and tender joints as well. And it's very important to treat this because psoriasis does lead to other infection or diseases or even health problems. According to psoriasis.com, things that can cause psoriasis can be anything from stress or injury to the skin, such as tattoos or cuts, scrapes, bug bites, sunburns, or an infection. If the patient is a smoker, it could also enhance psoriasis to appear or have a outbreak for patients that smoke, or if you consume a lot of alcohol, or also if a change in weather can also make a psoriasis outbreak. That's why it's very important for a patient with psoriasis to have a treatment or follow a treatment with their dermatologist, because psoriasis is a chronic disease and it won't go away. It will you will actually have a reoccurrence if you don't have a strict treatment. And dermatologists treat psoriasis with things such as topical, phototherapy, or systemics, which is either lotions or creams for the surface of the skin, as also ultraviolet light to treat the surface of the skin as well, and systemics such as pills or injections to treat the inside of the body. Although psoriasis isn't a disease that could kill you, psoriasis can lead to mental factors for patients that suffer from this disease. So actually, an article on Courtney Hargrim in Everyday Health, she stated that about 50% of the patients that have psoriasis suffer from depression and later on, because they don't want people to see them, or they feel uncomfortable, or they're so irritated, their skin is so irritated that they just don't want to be out. So patients with psoriasis do have a lot of depression or a lot of self-esteem or down self-esteem. They don't want people in their lives or things like that. So it's very important to treat psoriasis. I hope that you learn a lot more about psoriasis and you help anybody that might have it. Thanks for watching.